another topic that I want to talk to everybody about, and it's the diagnosis of diabetes. Most everybody's familiar with that term. I don't think anybody's not aware that this has to do with disruptions in proper sugar metabolism. Many of you are probably aware that there are two types of diabetes in a general sense. There's type 1 diabetes, also termed juvenile onset, and type 2 diabetes, also termed adult onset. Oftentimes we consider type 1 diabetes insulin dependent, type 2 non-insulin dependent. However, it's frequent that people in the type 2 category ultimately become insulin dependent. I want to explain to you the difference between the two. We'll start with type 1. Type 1 is more of a genetically moderated condition. So, though it does not breed 100% true in monozygotic twins, meaning people who come from the same egg, identical twin, there's a high level of correlation. What that means is that it's not a guarantee that both twins will have type 1 diabetes. And since they share the exact same genome, we know there must be some environmental issues. And if I understand things correctly, and I don't take care of a lot of type 1 diabetics, and it's not some place that I spend a lot of my time, but I think we still think there's probably a viral trigger in the setting of a genomic problem, a predisposition. What's the underlying defect? You can't make insulin. Your pancreas is an organ that has two functions, endocrine and exocrine. Exocrine is, it makes digestive enzyme. Very important from that. Endocrine is, it's like your thyroid gland, your sex organs, your adrenal glands. It makes hormones. The main hormone, the one that is so important to our long-term health, our survival actually, is insulin. You must have insulin in order to be able to get sugar into the cell used as energy. Not having any insulin is not compatible with life. We can use alternatives to sugar for energy, but we must be able to process sugar. Typically in young age or teenage years, occasionally later in onset, a person's pancreas no longer can make any insulin. They develop type 1 diabetes, and they are immediately in a situation where they have to be treated with insulin from outside the body. A medical term we use as exogenous. We got to treat them with exogenous insulin. It's obviously a very bad condition to have because it makes it very difficult to keep your blood sugars low. And when we get into the drivers of chronic disease, you will see that elevated blood sugar accelerates aging and accelerates the risk of almost all chronic diseases. Typically, it's not a lifestyle issue, though once diagnosed, lifestyle becomes very important to control the disease and reduce the ultimate downrange risk and mortality. That's type 1 diabetes. Type 2 is much more common. Type 2, also termed adult onset, oftentimes not insulin dependent initially, is a situation where we become insulin resistant. Now, just like all diseases, there's genetic predisposition, and there are some people who can live a lifestyle that would make one group of people insulin resistant and ultimately develop type 2 diabetes, and there's others that just don't have the genes for it, and even though they may have multiple factors in the way they lead their life that should lead to type 2 diabetes, they don't end up getting it. Now, I'll tell you, they have higher sugar than they would if they lived a healthy lifestyle, and their cellular health is not as good as it would be despite their great genetics if they followed my recommendations for lifestyle. But they might not get the disease regardless. There are others of us that have significant risk for type 2 diabetes. I fall into that category according to my genomic study. I think if I allowed myself to become significantly overweight, I would develop the insulin resistance that I saw occur in my dad and his dad. They both became insulin dependent late in life. Right now, I demonstrate no evidence of that. And quite a few of you out there are in this boat. The definition of diabetes is based on an average blood sugar, which we utilize a biomarker that I'll discuss when we get to biomarkers, but an average blood sugar that's over a certain amount. And when that number is reached, we term you diabetic. And if you are non-insulin dependent, you still make insulin, but you've become resistant to it, we generally have various medication strategies. Of course, we're going to, even though disease doctors are going to talk about lifestyle, but they're not going to invest in it like I will, trying to teach you guys how important it is to behave properly. So At any rate, there are medications that you can take orally that will help. They work through various mechanisms. Some make you more sensitive to insulin. Some help your body to produce more insulin since you're less sensitive. Some make you waste sugar. They all have significant side effects. In general, all medicines are non-natural molecules that exert some effect within the body, but there are certainly other effects that abnormal molecules that were not designed to circulate within the human body are having on our well-being. So it's not my number one strategy for controlling this disease process. And that's primarily because I set the example, and I think that the vast majority of people caught within time can prevent ever developing type 2 diabetes, even if they have significant genetic risk. I'm not going to say that type 2 diabetes is 100% preventable by lifestyle, but it's largely preventable by lifestyle. And like I told you, when we break off into discussing why diabetes is so bad, and at the root level, there's sugar in your system everywhere, and sugar gums up the works, and cancer loves it, and it accelerates blood vessel disease, and we'll get into it at the molecular level in another discussion. So I hope that was enough to broaden your understanding of the diagnosis of diabetes, which we all know means high sugar, the difference between type 1, you can't make any insulin, you're dependent on insulin for the rest of your life given to you from outside your body, and type 2, you still make insulin, but you can't make enough to keep up with your needs because you've allowed yourself to become insulin resistant. Understand that you can let that disease progress to the point where you also need insulin. Or you could come to some blended model where you take pretty good care of yourself through lifestyle and need only minimal meds. Or you hopefully have a health and wellness model where you reverse all signs of evidence of this disease and prevent it from ever rearing its ugly head in your life. And we're going to cover how to do that. Don't you worry. Signing off, and don't forget, when you learn and you understand all this that there is to know about the development of chronic disease, you can expect success at not allowing that to happen. Thank you.